Hi, Janessa. Thank you so much for your flashcard on GERD. Here's my case presentation. CJ is a 42-year-old male presenting to his PCP today for his annual physical. His medical history includes obesity with a current BMI of 32, obstructive sleep apnea, and depression. CJ is on a tricyclic antidepressant for his depression, which has been managing his symptoms well. However, he admits to moderate alcohol use, 2 drinks per day, and smokes 1 pack per day of cigarettes. He states he has been trying to cut down on his smoking and is interested in learning about the patch. He has been trying to chew gum to distract himself, but he recently has been having heartburn after chewing peppermint gum. He also experiences this occasionally after he drinks alcohol and smokes, and usually about an hour after eating. He describes the discomfort as a burning sensation right behind his chest bone. Sometimes he feels as though bile is coming up his throat and he can taste it. On exam, the patient is alert and oriented and has no pain. His heart and lung sounds are normal. He has active bowel sounds. His vital signs are as follows. He is afebrile. His heart rate is 82. His blood pressure is 128/75. His respiratory rate is 18 and his O2 saturation is 97%. You look in his throat and there is no redness or irritation that is visible. His mucous membranes are intact. He complains of no nausea, vomiting, or diarrhea. He states his appetite's okay, but he knows he could be eating healthier. You believe CJ has GERD, gastroesophageal reflux disease. The signs and symptoms that he is experiencing that point to this diagnosis include a feeling of regurgitation and retrosternal heartburn, which specifically is 50 to 60 minutes after eating, smoking, or drinking. Obesity is a risk factor for GERD, and this reflux can also be caused or aggravated by drinking alcohol, smoking, medications such as tricyclic antidepressants, and certain foods such as peppermint. Since GERD is typically just diagnosed based on patient presentation of symptoms, you decide to start the patient on a proton pump inhibitor trial. You schedule a follow-up appointment with the patient to assess the effectiveness of this medication. If the patient does not report improved symptoms, you will order an upper gastrointestinal endoscopy to assure that there is no malignancy that may be causing this symptom. You also give the patient educational information on smoking cessation. And here are my references. Thanks for listening.